I'm Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium. And this evening, we are going to be presented to by Dr. Scott Morris, who is with Church Health in Memphis, Tennessee. And Dr. Morris, I'm turning things over to you.
Great. All right. Well, welcome everybody. Hope you're well. Yeah, so I'm talking to you from Memphis. This is first time we've actually been involved with y'all, and I'm eager to talk to you a little bit about our work in Memphis and really how our residency is engaged in the work we do. So just a little bit about Church Health and Baptist Hospital, which is the hospital component of our residency. We've been around since 1987. What we do is provide health care for people who work in low-wage jobs who don't have health insurance. So we take care of the people who work to make our lives comfortable. They cook our food, they take care of our children, they wash our dishes, they cut our grass, they'll one day dig our graves. They don't complain, yet when they get sick, their options are very few. So Tennessee is a state that, in the wisdom of our legislature, has chosen not to expand Medicaid. So more than 85% of our patients don't qualify for anything, that they fall through this very big gap. And we are not a federally funded anything. We're a true charity. And I'll tell you more about how that works as we go along. So we currently care for over 70,000 people in Memphis. We are the largest clinic of our type in the country. We currently operate out of an incredibly cool building, which is called Crosstown Concourse. We are the anchor tenant in Crosstown, which is a building in square footage the same size as the Empire State Building. It was built in 1927. It was then abandoned in 1993 when Sears quit distributing things out of the Sears catalog, which is where your mother probably got her first washing machine, your dad got his first bicycle. If you lived in the South and you ordered something out of the Sears catalog, it came out of our building. We moved here for a lot of complicated reasons, but it was mostly about being better together, which is what I want to talk about here in just a minute, which is our view of health. So, from our perspective, being healthy is not about the absence of disease. The World Health Organization would agree with that. Who cares if you live 2 years longer, if it means 2 years longer in a nursing home? Life for life's sake can't possibly be the point. Breathing in, breathing out, none of us are signing up for that. We also view that health should not just be about trying to treat any type of disease, but helping people find a way to live healthy. Now, after 34 years of doing this work, our view of how this works is going to be very different than what you've been taught in medical school. It's not just about the knee bone connected to the thigh bone. Now, we want you to know the knee bone's connected to the thigh bone. We want you to understand a way to approach people's disease, but the focus needs for all of us to be on what does it mean to be healthy. So we would argue that there are actually three things for each of us that this has to happen in order for us to be healthy. So those three things are having more joy in your life, having more love in your life, and being driven closer to things greater than we are. Now, we would call that God. You don't have to call that God. But those three things, more joy, more love, and being driven closer to those things greater than we are, that is what ultimately leads us to being healthy. And yet, I would like to ask, each of you, if most of you I think are medical students, So in your school, how did you get in the joy? Did you get an A in the joy class? Raise your hand if you got an A in the joy class in medical school. Ali, you didn't get an A? You're shaking your head. You didn't, wait a minute. They didn't offer a joy class for you went to medical school, right? What about the love class? Everybody got an A in the love class? No. So these are not actually things that are talked about in medical school. And you know, for many people, that they think it's not even appropriate to talk about it, which is just crazy in our mind, because all of your patients care deeply about this. And I would want you to also care deeply about it in your own life. So if you're looking to match this year and decide where you're going to do your residency, or whenever it is you're gonna go try to match, if you are going to spend 3 years in a place that you are not convinced will bring you more joy, more love, and drive you closer to things greater than we are, then you shouldn't do it. You know, I would even go as far to say is that if medicine is not bringing that to you, then don't do it. Now, what is the practical implication of that? That's what I'm going to spend the rest of the time talking about. So more joy, more love, being driven to, closer to things greater than we are, led us to create something we call the model for healthy living. So I really can't believe this, y'all, but I think I'm not savvy enough, because I'm old, to share my screen in a way where you can see this. So I'm going to show you a video in a minute, but I think I can't. Oh, there it goes. Are y'all seeing that?
That's me.
My God, God is smiling on me in a big way, or else Larry put it up there for me.
I did.
There for me?
Yep.
I am so proud. Thank you. All right. So these 7 things we would argue are equally important to life, and they must be in balance. Now, this is just a riff on the social determinants. You know, I'm hoping and praying that you're all keenly aware of the social determinants. But you know, sometimes how that plays itself out in real life, and especially in clinical practice, is not easy for people to see and understand. I mean, academics can talk a good game about it, but what does it actually look like when you're trying to take care of a patient? You know, you ultimately, you have 15 minutes and you can't get there. You know, you just can't get there because, you know, and this is part of this is being a young doctor. You're still struggling to just how to know up from down, and we get that. But medical care has only 10% to do with anybody's health outcomes. What the doctor does, what the hospital does, any type of pills, y'all, we got to remember that all pills are poisons. That is how they work. They poison your body to prevent it from doing something it is naturally trying to do. You got to be pretty doggone smart to override the body the way God created it. You know, thank God the pills don't work very well. If the pills actually did everything they tell us they would do on TV, then we'd be killing people right and left. Now, look, I am a statin prescribing doctor. Don't think otherwise. But there's so much more to life than just what chemical equations can do in our body. You know, one thing, you know, how did we come to think that the way we deal with our body, which I would argue has more to do with electricity than chemistry, you know, why would we think our hearts run on electricity, our minds run on electricity, our brains do, our muscles do, and yet we want to impact how our body functions through chemicals? That just doesn't logically make a lot of sense. And yet we have built an entire healthcare system that works in that regard without really paying attention to these other things that we would argue matter every bit as much. So these 7 things, medical care, movement, work, emotions, nutrition, family and friends, and then we would argue your faith life is as important as anything the doctor would do. So Larry can't help me with this, y'all, but I'm actually going to share my screen and show you a brief video. It's just 3 minutes long that will tell you more about our work. And then it will also begin the conversation. And I just want to use nutrition as a starting point for how this actually plays out in our clinic and in our residency. So we'll watch this video, and then you'll see how our dietitians, our health coaches play into our practical clinic in terms of taking care of our patients. So I think this, and then just the video here will also show you our workspace in this incredibly cool building. Let's hope and pray when I press play here, it's going to show it to you. All right, here we go. Everybody seeing that?
Yep.
Yes. Okay.
So Scott, you need to know that the sound is not coming through.
There's no sound?
Correct.
No sound? All right. So Larry, there's no sound at all?
No sound at all.
All right, well, then I'll stop it.
I'm hearing something very, very low.
Okay.
Can you turn the sound up?
I just tried to turn it up and it still didn't come.
Is it just me, or did anybody else?
All right, I'm going to turn it up and we'll try one more time here. Can you hear that?
There you go. Yes.
All right. Okay.
Church Health is a faith-based nonprofit organization that provides comprehensive medical and wellness services to uninsured and underserved people in Memphis, Tennessee. Medical services include medical care, dentistry, eye care, physical rehabilitation, and behavioral health. Church Health also offers education and outreach programs to thousands of people each year. Being healthy is not just the absence of disease. We help patients reach their highest level of wellness in mind, body, and spirit. The key components of health is nutrition. Success in the kitchen is empowering people to manage and take control over what it is they cook. There are a myriad of diseases that can benefit from a registered dietitian referral. Sometimes I have patients that generally have a good idea of what they should and should not be eating. And then I have other patients who come in and tell me these ideas, and they're completely wrong. There's something that they learned from a friend or relative or someone who's had the same disease before. There's cues during a session that I have that tells me what I need to cut back to make sure that they understand. We are part of the whole medical treatment plan. And just by the sheer logistics of brand nutrition ideas was a statement of how important we feel nutrition is to your overall health. So success is any step further in the right direction. It doesn't have to be these huge changes, and I don't expect them to make all these changes overnight. It could be this very slow process, but really any little step in the right direction. People in these classes are from access and backgrounds. It's just a hodgepodge between that. That's what they have. That's what our city is. But again, that they can spend one-on-one or smaller time with our patients in the nutrition lab, in the clinic, and get to know what it is they need and have them learn a couple techniques. They learn how to cook an egg, but guess what? They learn how to cook a zucchini and a tomato and an onion, because those things are the same. We just arm them with 1,000 recipes. Their cooking is going to make it healthier than anything else they find. With itself, Bluebird was able to get a grant for what we call nutritional meals. They needed a destination Church House serves 10 each year. But we cannot do this alone. We invite you to join us in creating innovative means and strategies to meet the health and healthcare needs of our patients, their families, and the wider community. To learn more, visit churchhealth.org.
So Scott, I think the sound was weak coming through, but I think the pictures told the story.
Okay, well, good. I hope you at least could hear some of it. Well, I want to just talk about, again, remember our wheel, again, we call the model for healthy living, 7 things. But I just want to spend some time talking about nutrition and how this plays out within our clinic and within our residency. So if you come to our residency, you're going to be fully inundated in a way to practice medicine that incorporates all of these. So what I am pretty sure of is that probably none of you have been taught hardly anything about food. You may have had a few classes about nutrition, but this has not been a high priority. And what you know, you can put in a thimble. Well, you come to our residency, that is not going to be the case. So how does this actually play itself out? So you saw within the video, both our one of our registered dietitians talking, but we have an entire staff that works out of what we call the Nutrition Hub. That was funded by FedEx, and hubs are big things that FedEx does. So we like calling it the Nutrition Hub. But the practicality of this, let me just walk you through a number of programs that we have here that being involved in our residency, you will become so much more versed in food than you're ever going to be, I would argue, anywhere else. So there was a reference there to what we call nutrition on wheels. So we have partnered with Mid-South Food Bank, and this has been funded by United Healthcare, a ginormous insurance company based in Minnesota. But even though 85% of our patients are uninsured, to United's credit, they have worked with us to try to develop a way that we could actually provide food to our patients in real time. So how does that work? Patients are asked the question, over the last 2 weeks, have you run out of food and felt hungry? They are also asked, have you in the last 2 weeks skipped a meal because you just didn't have the food? If the answer to that is yes, then they get given a voucher which allows them to come to our Nutrition on Wheels program. Again, that's staffed, and the produce comes from the Mid-South Food Bank, and people are given fresh produce. Now, that is something that rarely happens in food pantries, but the same thing is true even if people have EBT cards, then they can use their EBT cards, but on top of that, they leave with a box of fresh produce. Now, also within the clinic, patients are, from the doctor perspective, if the physician believes that this person is food insecure, when you come for your regular visit to see the doctor, we, in that kitchen that you saw in the video, we actually have volunteers that cook meals on a daily basis. It actually costs people $25 to volunteer. And then the meals that we cook are stored in our welcome center, and a person can leave, perhaps with a prescription for pills, but we would argue even more, a prescription for food. So they would leave to be able to take home that night a healthy meal that has been cooked on our premises for their entire family. Now, this is just a beginning for us to get to the real issues of changing behavior. Now, our health coaches and dietitians are fully embedded within our clinic. So you at any point are not going to be expected to be the full expert. We know if you come to us as an intern, you're not going to know hardly anything. So the dietitians are there as your partner to work with patients who are either food insecure or on the other extreme, dealing with obesity that comes about because of poor quality of food in America, and especially in the South where we are. Now, we have also, for years, been partners with Tulane Medical School around this idea known as culinary medicine. I hope you're familiar with this. And y'all, truthfully, this is an interesting thing with COVID. We are now moving on to create our own curriculum to train both medical students and residents. And I mean, Tulane is primarily focused on the medical side of this, but from our point of view, why would we just be training doctors on this? So we are now going to be using our curriculum, yes, for medical students and residents, but also for our dentists, for nurses, for the entire community. We have community classes where people can have the experience of cooking food in our kitchen with the plan to be able to take it home. You, coming to our residency, we're gonna turn you into you will not live art alongside patients. You will develop the ability to actually cook your own meals, but then now have real skills to talk to patients about food. Okay, there are other ways though that we have to be fully engaged in the community. Again, it can't all just happen in the doctor's office. So our name is Church Health. Memphis is an incredibly religious community. We use the word church in a very generic way. So, you know, from a Christian perspective, Paul says we see through a glass darkly. We think that means none of us have all the answers. We need each other in every way possible. So diversity in all its form is a good thing. So we are very intimately connected with churches, synagogues, mosques, you know, Jewish, Christian, Hindu, Muslim. They are all fully connected to Church Health. And when you're in Memphis, you would quickly see how that works. However, there are 2,000 congregations in Memphis, and we would argue the least healthy meal you could eat anywhere is in a church or a community of worship. We have blessed the sin of gluttony for the sake of fellowship. That just cannot be the way we continue to do this. In the midst of the obesity epidemic in America, clergy are actually 20% heavier than the rest of the population. So you can't have a healthy congregation if you don't have healthy leadership. So our staff works diligently to try to engage faith communities, and we do this through two main programs. One is we go to church cooks and the people who cook congregational meals, and we bring them into our nutrition center and teach them a better way to provide congregational meals. You know, we are not trying to totally change the way people eat. If we're not trying to make people eat tofu. But again, this is the South. We spent over $20,000 to develop a recipe for greens that tastes like they have a pound of fat back in it. You know, we will put our greens recipe up against anybody's grandmother, and we will win because it is actually better. It tastes better, not to mention that it's healthier. The The other thing is we've partnered with the University of Tennessee's Department of Agriculture in developing a program we call Faithful Families, in that one of the things that happens because of poverty is that people never eat meals together. That they always eat alone. They eat in a fast food restaurant in their lap on the way to wherever they're going. So trying to create rituals of family behavior is what this Faithful Families program is all about, because it's been shown repeatedly that if you can sit down with a meal together with family, people will have a tendency to both eat healthier, and it creates a lot of good downstream healthy behaviors just by virtue of families coming together. So I'm just trying to give you a feel for how our model for healthy living actually works its way out in creative ways. Now, just a few other components here. So in our building of Crosstown, this building that is the same size as the Empire State Building, we actually have a high school. And if you're interested in school-based healthcare, we both run a preschool and an elementary school, but within our building, there is a high school. And the high school uses our kitchen for 9th and 10th grade biology, using food as a way to teach kids biology. So that we bring the kids into the kitchen and they are taught their biology through the process of both growing food in a community garden and then using it to cook, as well as developing skills that they otherwise wouldn't have. Now, my absolute favorite program is something that's known as Tiger Life. So we have partnered with the University of Memphis around dealing with young adults who have intellectual disabilities. So these are mostly kids that have Down syndrome. It's not exclusively Down syndrome. They are high functioning young adults, but in this situation, their parents are terrified of two things. Will they ever be able to live alone? And would they ever be able to hold a job? So within our kitchen, we teach nutrition skills. And then within our center, we use them as greeters in our welcome center. Now, I just learned last week, one of our Tiger Life kids, through what he has learned in our nutrition center, got a job just even in the midst of COVID, working for Jason's Deli. I don't know if y'all have Jason's Delis where you are, but that is just so cool. I mean, it is addressing all the issues that we care deeply about. So again, I'm just telling you, within our residency, I'm guessing you're not going to find anybody else where you're going to be in a residency and you're fully immersed in all of this. And then lastly, we engaged both the Muslim and Jewish communities in Memphis to have ongoing cooking classes where the senior women in both the Jewish and Muslim community, they hold cooking classes to pass the sort of both Jewish and Muslim recipes on to a younger generation. I mean, I can tell you all the food's unbelievably good, but it's just one more thing that happens here. Okay, so all of my talking here for the last 30 minutes is over just one of these issues, nutrition. And I've truly just skimmed the surface. If we move to movement, our bodies were made to move. Hopefully in medical school, you're at least getting some exercise, but with us, many of our patients, they're poor, they're sedentary, obesity is definitely an issue. So within our clinic, the last thing we want is for you to should all over our patients, telling them they should do this, they should do that. That never works. You know, do not do that to people. You know, creating that sort of shaming experience is never going to change people's behavior. So within our building, we used to run our own wellness facility, but what we have done now is we have partnered with the YMCA and created what's called Church Health YMCA. So it's 25,000 square feet of church health space. If you come and do our residency, you will actually get a membership in Church Health Y. But then the experience is that the Y is literally directly contiguous into our resident clinic. So if you think somebody needs to walk more, get more exercise, rather than just tell them to go do that, you just need to get up out of the exam room and then go through a door, and you are immediately on our indoor walking track. And you can go for a walking visit with your patient. You know, this is just an example of there's so many more better ways to practice family medicine than just being obsessed over giving people pills and trying to learn how to stick a tube in every orifice of that person's body. Now, moving on to the emotional issue. 50% of the people who come to primary care doctors like us have no medical problem. None. People come to the doctor for reasons they used to come to the priest. Now it's all very complicated why that is. You know, I saw this patient not too long ago. She's 42 years old. She's Latino. She's undocumented. She's working in the suburbs cleaning houses. And she's there one day and the owners are not there, but there are other workers there and they rape her. Now, because she's undocumented, she does not call the police. Instead, what she does is go and talk to her pastor, who gives her very bad advice. He tells her she needs to keep working in that house because she needs to, quote unquote, confront her demons. That was not good advice. 6 weeks after this event, she comes to our walk-in clinic and I end up being her doctor. So in talking to her, you know, she's complaining of pain in her pelvis. I do her pelvic exam and it is totally normal, because that's not the problem, right? The problem is that they have totally crushed her heart. Now, I don't have any pills that are gonna fix a broken heart, you know, and my giving her an extra 15 minutes of my great wisdom is not gonna do anything. So what I was able to do and what our residents were able to do is we were able to call in one of our Spanish-speaking counselors, who then was able to spend an hour with her in the exam room, and I moved on. I kept doing what the doctor could do. And the counselor saw her then and then followed up in our behavioral health center, which is all part of Church Health. Now, I subsequently have seen her back. The pain in her pelvis is gone, but I cannot sit here and tell you we have fixed her. We have not fixed her. But what we are doing is dealing with the real problem. So these are things that we find incredibly important for young doctors to learn, because what invariably happens is people end up going to the emergency room with pain in their chest. The emergency room doctors do all sorts of tests. We might even, you know, do a cardiac catheterization, and then we tell the person there's nothing wrong with their heart. Well, the reason for that is you can MRI somebody's chest all day long, and you will never know what love looks like. Remember how we began with joy, love? You know, why would we expect you to know much about how to deal with love issues when you've never really been taught how to deal with those? So coming to our residency, these sorts of issues will be front and center, which is lastly to deal in the one that, you know, I have no idea where any of y'all are from your own faith perspective. It doesn't really matter to me. But the faith component to life is critical to all of us. And it is especially true to patients. It has been shown over and over and over again that patients actually would like their doctor to talk to them about how issues of faith could actually improve their health outcomes. Now, that is not about you imposing your faith beliefs on patients. You know, we do not do that. We don't condone that. But patients want to have these issues be brought up. And again, I'm willing to bet that in your medical school, this is anathema. You know, this is like, you are never supposed to talk about this sort of stuff. Well, we don't agree with that at all. And so we actually have a Yale-trained young African-American theologian who meets with our residents on a regular basis. This is we have a monthly didactic time where we talk about spirituality and medicine. And the issues can be anywhere to how do you talk to people about death and dying? You know, how do you talk to people about, you know, they have a terrible cancer diagnosis? And it's not just calling the chaplain. We have to get beyond that. And it is so powerful how this creates strong relationships between you and patients as time goes on, because to be a family doctor, that's really the most important thing you can do, in my opinion, is to create lasting relationships with patients. You know, I've been doing this in our clinic for 34 years. And this morning, I saw a woman who remembered me back when we were just in this one little house, you know, long before we moved into this really cool building we're in right now. And we just talked about it. You know, we were both younger. You know, she's 83 years old now. And, you know, but being able to talk about her relationship with us over a 34-year period is just such a powerful thing. And, you know, this is Memphis, this is the South. I mean, the thing that sustains her more than anything else is her faith. And truthfully, I feel confident I got more out of this visit than she did. And that's the type of doctors we want to train, are people who will feel that way. All right, I am tired of hearing myself talk. So I don't know if anybody has any questions, but I would love to open it up to hear you. And I don't know, yeah, thank you, great. Anybody with questions?
So you can use the chat room, or you can unmute yourself and go for it.
Right. Yeah.
Hi, this is Carolyn Peterson. I'm calling in from MUSC in Charleston, South Carolina. And I was wondering,
we like that.
I was wondering if you could talk a little bit. Our last talk was about medical legal partnerships, and they talked about at Metro Health how they have some options for like undocumented immigrants with situations like that patient you described, and if they had a crime committed against them, that they could be referred to a lawyer who could help them deal with that situation and have resolution from that respect. Do y'all work with any lawyers at your program?
Yeah, so Carolyn, 50% of our patients speak Spanish, although it's not just a Spanish issue. I mean, one day my first 11 patients spoke 11 different languages. You know, this is Memphis, this is not New York. But no, we have lawyers embedded in our clinic. So, I mean, we haven't talked about that, but yes, we are keenly involved in the immigration issue. You know, I would tell you as a resident with us, I mean, you have got to understand a person's immigration status in order to fully take care of them. Because even if they are American citizens, the people they love are not necessarily that way. And so engaging them in ways to, number one, create a safe environment it took us years to be able to do that. You don't just hold up your shingle and say, hey, this is a safe place. It doesn't work like that. Anyway, you're asking about the lawyer stuff. This lawyering stuff is ridiculously complicated. So there are limitations as to the issues that we deal with legality, but embedded in. Anybody else? Yes. Really, somebody does. Miguel?
Hello, Dr. Morris. Thank you so much for talking about the importance of joy and love. It was something I was hoping to get out of medical school, like you said. And it wasn't until right now I'm at home and doing a virtual clerkship that I studied about like Patch Adams and his dedication to happiness and the importance of gratitude. I was asking for your advice, if we end up at Baptist or wherever we are, how to keep that as part of our education. Yes, we will try to find a place that will promote us to grow spiritually, to grow in our love and our joy. But it's hard to find that, And so if it makes us have to work more, any advice you have for us to continue to kind of develop that to be better healers and patient providers?
Yeah, so Miguel, I'm really glad you brought this issue up, because what I see happen is that virtually every medical student, every last one of you, I'm willing to bet, went to medical school for one primary reason. You want to help people. Now, along the way, that gets beaten out of you. And you ultimately get converted to what I refer to as the religion of medicine. And, if y'all are far enough down your own training here, you know exactly what I mean by that. My own experience was, so I went to seminary before I went to medical school. Don't hold that against me. But I'm a third-year medical student at Emory in Atlanta, and there's a code. I'm doing what the third-year student is supposed to do, which is chest compressions. And I'm sitting there doing chest compressions, and then the chief resident walks in the room, and with the team of residents and medical students. Now, mind you, I had this person's life underneath my hand. And the chief resident asked the question, hey guys, when this is over, where are we going for pizza? And I find myself thinking, do I want pepperoni? Now, I felt at that point I was about to go over the edge into the abyss. Now, thank God I pulled myself back. And so don't let that happen to you. If you come to our residency, we're going to work every way possible to show you a better way. But I would argue for each of y'all that the very fact that you're interested in being family doctors tells me that you don't want to go that path, but it is so easy. And if you're not fighting it at every turn, you're going to be thinking about pepperoni too.
Thank you.
Sure. Anybody else?
So,
Yes.
Go ahead, Simon.
Thank you. Sorry if I'm interrupting. Thank you very much for the presentation. I really appreciated it. I'm at Stony Brook. I'm in my third year, so I still have another year to go. But I was wondering if you could talk a little bit about the piece of advocacy training with respect to healthcare policy, anything in that area, how it fits into the otherwise very comprehensive sort of circle or picture that you have developed.
So your advocacy training, that's what you're asking. Why would you think there needs to be advocacy training?
Well, a lot of the issues.
There's chaos in America, right? Is that why you're asking? Yes.
Yes.
So look, our challenge in Tennessee, first and foremost, is that, first off, in the wisdom of the Supreme Court, Justice Roberts made it possible for each state to determine on their own whether they would expand Medicaid. So, you know, no state in the South expanded Medicaid. And, you know, Tennessee and Mississippi sort of lead the way. I mean, who leads the way is Texas, but Tennessee and Mississippi is not far behind. So we are very much, I mean, because we are the largest of the what's known as free and charitable clinics there is in the country. And what free and charitable clinics do is primarily deal with the uninsured. So we are very much at the forefront of trying to address these issues, but it is a very, very complicated, difficult thing. I can tell you it is very hard to be an advocate and a provider at the same time, because as soon as you go down the path of advocacy, you're going to piss a bunch of people off. And if what you want to do is, like, you know, our mission is to provide the same quality of care you'd expect your mother to receive. And if in order to do that, you can at times be playing with fire if you become too aggressive yourself as advocates. So we are very tight with other entities that deal with advocacy, but we are not out front ourselves all the time, except for on things that I'm willing to spend our chips on. So for me personally, the issue I will lay down in the street over is immigration. I will probably eventually have to be bailed out of jail over that. You know, do I think Tennessee will ever expand Medicaid? Not if East Tennessee has anything to do about it. So you just have to be strategic around these issues. So anyway, the answer is yes. You come to us, we're going to talk to you all about it. You know, you want to leave being an advocate, we are tight with every major advocacy group there is in the country. And, you know, I think they respect our work in a big way.
Thank you.
Great. Anybody else?
Hi, my name is Kayla. I'm a fourth year from Howard University in DC. Thank you for your presentation. I just had a quick question about the nutrition component. I definitely agree that I didn't receive much education on that in med school, and I had to do kind of my own self-learning when counseling patients. In terms of the fresh produce, for the patients, do any places, do you have any like partnerships with some cities? I'm not sure about Memphis, have like community gardens or city gardens. Is that something that you guys are a part of?
Yes, so we have our own community garden, Kayla. Community gardens are good, but they are not enough. So the food issues for us, we are looking for bigger answers. So like on October 22nd, you're more than invited. It will be virtual because the whole world's virtual. We are hosting the Memphis Food System Summit. It's a mouthful. But again, Church Health is the convener of this program. If you go to our website, which is churchhealth.org, you know, you'll see how the Food Systems Summit, how you would enter it. Or if you send me an email, I'll be happy to make sure you get invited. I mean, it is just hard, man. Food is hard. And, but community gardens can be very useful to get people thinking about it, but they don't produce enough food. What we have to do is develop systems that actually allow poor people access to high quality foods. And it has to get beyond just our feeling good about ourselves that we, you know, gave people, you know, a few radishes. That can't be the long-term plan. But so we are engaged with everybody in Memphis and the Mid-South, which includes Mississippi and Arkansas, over trying to think in a much bigger way. But look, in the short run, absolutely, we believe in community gardens. Again, our high school and our building runs our community garden. which we're very proud of them for what they do. And, you know, we're in this for a marathon. You know, it's not just, there aren't simple solutions around this food stuff. But again, within our residency, if you come and you have ideas about this, then we're going to make it possible for you to be engaged around that. Now, the problem for me is that the AAFP requires you to spend all this ridiculous amount of time in the hospital, and we want you to be board certified. So those two things are not always compatible. But nevertheless, we built a medical Disney World for you to at least be able to put your toe in the water around this. And, you know, as you move through our program, the more, if you were like really focused on issues of food, we're going to give you plenty of opportunity to do it, not just in the clinic, but within our community. And again, you know, Memphis historically is the poorest major city in America. And so the opportunity to make a difference is great.
Thank you. I definitely agree. It's a very complex topic and something I'm definitely still learning about. So I just want to ask about that. DC definitely has its food deserts in certain parts of DC, mostly southeast, southwest. So I definitely agree. It's complicated.
Yeah, but that's not a reason to give up. Sometimes things being complicated, people just throw their hands up. You know, I can assure you that when I had the idea of turning this abandoned building that's the size of the Empire State Building, that was surrounded in barbed wire and had gotten to be where why would gangs write anything more on it? What more was there to say? You know, people thought I had lost my mind. And maybe I had lost my mind, but you know, you just have to keep hammering away around these things, and you have to focus on ideas, because the world is run by ideas, and money follows ideas. So we were actually able to raise $300 million to do the renovation of this building, and now it shows you what's possible in God's imagination.
So, Dr. Morris, I'd like to tell a story, and I want to preface that story by saying that I live in Dayton, Ohio. My wife and I do, but our daughter and her family live in Memphis, Tennessee, about 1.5 miles away from that big Sears distribution center. And I remember the first times when I'd go running, there's a reclaimed railroad area that's a nice running path. And I went by that building, and it was just a god-awful urban eyesore. I mean, windows busted out, chains all around the building, concertina wire to keep people out and all. I mean, it was just an urban eyesore. And I was wondering how the heck it cost a fortune to take down a building that big and reclaim the land for use. And not too long ago, I was going to go for a run, and my daughter said, "Hey, Dad, you need to go check out that building. You haven't been there in a while," just because they had a grand opening the other day. And I ran down there and went inside, and I was stunned by what I saw. And that's when I kind of tracked down Dr. Morris. I look for family physician innovators who change systems. And I was really stunned by what I learned. And here's the little story I want to tell you about how these guys play. So they learned that in the inner city, kids don't learn how to swim. So what did they do? They went out and raised $3 million and built a swimming pool and started holding classes. I mean, the ability to swim is a life-saving, health-producing skill. I was just stunned. How many residency programs would say, well, let's just go build a pool and set up and do all the things that they've done. So that's really the kind of people that they are. It's just so incredibly impressive to see what can be done. Now, I want to respond to a question that Miguel asked here. could we incorporate more sessions on the importance of joy and love in our training and care in family medicine next year? I have not seen the whole program yet, but I think we are lacking a session on the topic. You are right. You will not find a session, I believe, on joy and love. However, you will find a lot of people who that message will resonate with. So I was the behavioral person. I'm a social worker in Penn State Hershey's residency program for 13 years. And I ran the resident support groups. And I will tell you that if you are looking at a family medicine residency program and they don't have a dedicated support group, whether it's a Balint group or something else for the residents, and you're interested in joy and love, don't go there. What you need to do, and I'm saying this now to everybody, is when you go visiting the residency programs, ask them the question, how do you folks deal with, how do you support my interest in love and joy? And just kind of listen to what they say. And I can tell you, because I've got to know Dr. Morris, we've met like 4 or 5 times now, and I've had a chance to see you in that beautiful facility with all those resources. They definitely personify commitment to that. But I think you can also, if you ask for it, and if you don't hear a good response, don't go there. And the other thing is, you will become like the people you hang out with.
Yeah, that's for sure.
If you hang out with people who are looking for the pepperoni that you were talking about, you will become like that. It's hard to swim upstream, especially for 3 years, and to get training. You need role models, and you need a whole program and a behavioral person in that program who's a core member of that faculty. That's one of the ways that you can tell whether or not that program is really committed to that issue. So I just thought I would throw that out. We have
Thank you, Larry.
just a couple minutes left.
Well, let me just say, number one, we are, in terms of commitment, we are truly committed to diversity. I mean, we're a small program right now. We've been a 444 program. We're growing starting this year to 666. 9 of our 12 residents are people of color. We care deeply about these issues that you have to address front and center. That's number one. Number two is our website is churchhealth.org, churchhealth.org. There's just wander around in there and you'll get a better feel for it. And then I hope you'll come visit us at the conference. We'll be there. You'll meet the residents, not just the old white guy, tomorrow and Friday and Saturday. And then for those of you, if they're the 3rd years here, we do offer junior internships. And if you just email me, which my email is Morris S. I should put that in the chat here. Of course, I don't know how. Yeah, Morris S. M-O-R. Whoops, not doing. I-S-S. So 2 R's, 2 S's at churchhealth.org. Anyway, if you want to come to Memphis, we would love to show you around. I did mention you have to come to Memphis. You're going to do our residency, right? Yeah, we're not in New York. We're not in Washington. We are in Memphis, which up until COVID is the #1 place millennials were moving to. And there's so many cool things in Memphis. Here's one of the things about Memphis. If you want to go to Atlanta or New York or Washington and make a difference, good luck, because nobody's going to care. You want to come to Memphis and make a difference, the door is wide open. And we are looking for people like that. We are looking to engage young doctors who want to go change the world. You want to come change the world, you ought to think seriously about coming to us. All right, we're over time, but Larry, thank you.
I'm going to bring things to closure and say thank you, Dr. Morris, and thank you to everyone who's come this evening.
Yep. Thank you, guys. Appreciate your taking the time. Good luck with wherever you end up.